Hello, this is a preview on general pediatrics. What is the average weight gain in the first 3 months of life? 10 grams, 15 grams, 20 grams, 30 grams, or 35 grams? The correct answer, 30 grams per day. The weight gain between 0 and 3 months is approximately half to 1 ounce, which is 15 to 30 grams per day. From 3 to 6 months, the weight gain is approximately half an ounce, which is 15 grams per day. From 6 to 12 months, the weight gain is approximately 10 grams per day. From birth to 4 to 6 months, the average weight gain of 1 to 1.25 pounds, which is 450 to 565 grams each month. Failure to thrive. If the weight is affected more than the height, the most likely cause is nutritional. Failure to grow. If the height is affected more than the weight, is most likely hormonal. In this growth curve, you will see the percentile of the weight start to be affected between age 5 and 6 years of age, and here the height start to be affected afterward. So the most likely cause here, failure to thrive, nutritional or GI problem. In this growth curve, you will see the decline here, and the height is more affected than the weight. And the most likely cause here, height affected more than the weight, is failure to grow, short stature, or endocrine problem. What is the average head circumference in a full-term infant? 25, 30, or 35, or 40, or 45 centimeters? The correct answer, 35 centimeters. The average head circumference in a full-term infant is 35 centimeters. Normal head growth from 0 to 3 months of age, head circumference will increase by 2 centimeters per month. This will give you 6 centimeters in the first 3 months. Between 3 and 6 months, the head circumference increased by 1 centimeter per month. This will give you 3 centimeters in the second 3 months. Between 6 and 12 months, the head circumference increases by 0.5 centimeter per month. This will give you 3 centimeters in the second 6 months. Between 1 and 3 years of age, head circumference increases by 1 centimeter every 6 months. Between 3 to 5 years, the head circumference increases by 1 centimeter every year. Average 5 centimeter total gain in head circumference occurs during 1 to 5 years of age. So the total centimeter in 1 year is 12 centimeter. 12 centimeter gain in head circumference occurs during the first year of life, which is here 6 centimeter plus 3 plus 3. This will give you 12 centimeter, and this is in the first 12 months of life. A father brought his son to your clinic worried about his development. He is not crawling yet and is not able to walk, but able to pull to standing position. What is the most likely age of his son? 9 months, 7 months, 6 months, 15 months, or 14 months? The correct answer is 9 months. 9 months will be able to pull to standing position. But not all 9 months are able to crawl. So some 9 months they don't crawl at all, they just go for walking. And walking classically between 12 and 14 months. 9 months it begins creeping or crawling, pulls to stand, radial digital grasp of cube. Separation and anxiety start at 9 months. Orients to name well, says mama dada non-specific. 9 months developmental red flags if is unable to sit without support, not rolling, doesn't babble, no sounds. Contraindications to vaccines. It is important to know that it is always okay to give the vaccine. For example, the child is having fever, 102, 103 Fahrenheit, otitis media, diarrhea, taking antibiotic, give the vaccine. It is okay to give the vaccine. Always this is the correct answer. The exceptions are few, and pay attention to that. Severe allergic reaction to this specific vaccine. So if you have a child with history of severe allergic reaction to influenza vaccine, anaphylaxis, do not give influenza vaccine. It is contraindicated. If you have a child, for example, with history of encephalopathy after giving DTaP, do not give DTaP. If the child is immune deficient, do not give live vaccines, but you are able to give the rest of the vaccines. No live vaccine, no rotavirus, no MMR, no varicella. Administrations of vaccines. You have only one oral vaccine, rotavirus vaccine. It comes in two forms, Rotatec or Rotarix. Rotatec 3-dose series and Rotarix is 2-dose series in the first year of life. Oral polio vaccine no longer in US, but it is considered if you have a child coming from another country with immunization record showing oral polio vaccine, consider these vaccines towards immunization status. Subcutaneous vaccines, we have MMR and varicella. What happens if you give MMR or varicella intramuscular by mistake? It is considered to be count, so you are able to count that toward the immunization status. You don't have to repeat. Intramuscular, all other vaccines are intramuscular. Syringes and needle sizes. Needles and syringes used for vaccine injections must be sterile and disposable. Very important to use the appropriate needle length, and this will depend on the age and the body mass. Very important to know that use of longer needles has been associated with less redness, less pain, less swelling, less discomfort than occurs with shorter needles, because injection into the deeper muscle is associated with less reaction. So very important when you give the injection intramuscular to reach the middle of the muscle, as we see in this picture. So again, for intramuscular injection, the needle should be long enough to reach the middle of the muscle to prevent the vaccine from seeping into the subcutaneous tissue and giving you redness and reaction. In this slide, we'll learn the appropriate injection site according to the age and needle length, appropriate needle length. For injection site, from birth to 24 months, the best site to give any injection is anterolateral aspect of the upper thigh. Injection site in older children, 2 years and older, you can use the deltoid muscle of the upper arm, and also you can use still the anterolateral aspect of the upper thigh. For needle length, under 12 months, use 25 gauge. 1 inch if it's intramuscular injection, 5/8 inch if subcutaneous injection. For 7 to 10 years of age, use 25 gauge with one length 1 to 1.25 inches needle size in deltoid for intramuscular injection. For subcutaneous is still 5/8. So very simple. All subcutaneous injections 5/8, 25 gauge needle size. If you have older child like adolescent 11 to 18, you will use longer needle, 22 to 25 gauge. The length is 1 to 1.5 inches for injection in the deltoid muscles.
Having trouble or trying to pass the pediatric board exam? We have the definitive solution for you, presenting the Last Minute Review series, a powerful tool for achieving success in pediatric board exams, crafted by Dr. Osama Naga, a board-certified pediatrician by American Board of Pediatrics and the editor of the Pediatric Board Study Guide, a last-minute review. Dr. Naga breaks down the most critical subjects in this series. The Pediatric Last Minute Review webpage offers a thorough and rigorous set of pediatric board review sessions that are in line with the study guide. The lectures will cover the most important topics for each condition that a pediatrician must know for pediatric board exams, as well as real-life clinical encounters. The inclusion of a clinical case scenario, accompanied by multiple choice questions, followed by the most probable answer and a comprehensive description of the issue, will ensure test readiness for each student. You will be able to download the lecture's PDF files to make your studies easier, to take notes and be accessible on the go and offline. Based on the membership plan you choose, you will have unlimited access to the lectures for either 1 month, 3 months, 6 months, or 1 year. By viewing these videos, you will increase your chances of passing the board exam and gain substantial advantages from the acquired knowledge. Additionally, by studying the material and completing the AAP prep questions from the previous 3 years, you will greatly increase your likelihood of passing the board and will acquire a wealth of knowledge. Click on the link provided below to visit lastminutepediatric.com and subscribe immediately. Be sure to take advantage of our free video samples on our YouTube channel, Pediatric Board Last Minute Review. Good luck with your exams!